would just like to we've got a case study now from the Wooditch Court Aboriginal Corporation. So Shondelle Stefano is going to talk about how they deliver ENT clinics and work collaboratively to assist and support patients and families. So please join me in welcoming Shondelle.
Just for my colleagues as well.
If you introduce your colleagues.
Sure, thank you. Kaya. Good morning, everybody. My name is Shondelle. I'm from Wooditch Court. I'm a proud Noongar woman from Nalakala Budja region. These are my work colleagues, Nikita Little and Monish Pika. So if you'd just like to introduce yourself, please.
My name is Nikita Little. So I am Aboriginal health practitioner, born and raised in Perth, Kwinana. I have family ties from Pindley, so I'm a Noongar woman, Wajak, and also Yamaji from Geraldton, Northampton, and we just found out Bijadanga from in Broome. So yeah, we go all around.
Hi, my name's Manish. I'm the Coburn Aboriginal Ear Health Officer. I work alongside Wooditch Court and Coburn Integrated Health. My family is from Darwin and Alice Springs, and I'm studying to be an Aboriginal health practitioner.
Thank you, ladies. So yes, I'd just like to mention that Nikita is also an Aboriginal health practitioner and has been with Wooditch Court for quite some time. So she's, I've seen her move through the ranks for over the periods of time, and she's doing a sensational job. So I just wanted to acknowledge that she's doing, she's a great leader as well. So well done, Kita. Thank you. So my role is the Clinical Services Manager at Wooditch Court, and I'm a Senior Aboriginal Health Practitioner. I studied at ACCHS, and I've been at Wooditch Court for around 10 years, so working across different programs from maternal health, chronic disease management, and into the clinic space and the school programs. So before we get started, I'd just like to acknowledge that we're meeting on Noongar Wajak Budja today and acknowledge the connections to the lands, the waterways, communities, and pay respects to elders past, present and emerging. So just a little overview on Wooditch Court Aboriginal Corporation and who we are and what programs we deliver. So Wooditch Court is a not-for-profit Aboriginal community-controlled organisation established in 2010, continuing to support health and wellness to the Aboriginal and Torres Strait Islander communities within WA. We have sites in Parmelia, Midland and Northern. Wooditch Court, and staff provides clients with access to culturally safe services and empower clients with the tools, the knowledge and confidence to make informed decisions regarding their health and well-being, while supporting clients on their health journey. Wooditch Court are working towards implementing a one-stop shop for the community. The ACCHS model of care is at the forefront whilst delivering cultural safe services for our clients, ensuring clients feel supported by advocating and breaking systemic barriers when accessing healthcare services. Wooditch Court delivers programs such as the Aboriginal Wellness Centre. The Aboriginal Wellness Centre provides fast-track referral access to services and like hospitals. So if anyone needs transport, we're able to sign them up very quickly for them to access medical appointments under that program. We also have Kwinana Schools program, integrated team care, transition care program, elders care support, country to city, mental health and suicide prevention, CCCP, Indigenous healthy lifestyle program, QAMS, which is connected to Flinders University and is a diabetes management system. The Damper Group, which is servicing a program for our elders around dementia prevention, and NDIS. Wooditch Court strive to close the gap in Aboriginal ear health by working collaboratively with Coburn Aboriginal Ear Health Program Consortium. So a little bit about our team. So our CEO is Annie Young. and the remaining staff, we have around 50 staff members across the metro area. And we have around 9 Aboriginal health workers that are currently studying at Wooditch. So hopefully they'll graduate soon and we'll have more AHPs on board. Just like to acknowledge our key stakeholders and collaborative partnerships. Rural Health West, who funds our Healthy Ears, Better Hearing, Better Listening program. We have 4 outreach ENT specialist clinics annually, delivering 4 half-day sessions with a maximum of 8 bookings. And we have Dr. Anton Hinton-Bayer attending at the Parmelia site. WA Country Health Service fund the Kwinana Schools program and the Aboriginal Wellness Centre until June 2026, and we employ, I fall under that program, so the Clinical Services Manager as a Aboriginal health practitioner, and also an additional Aboriginal health practitioner to support the school program. So last year, myself and my team coordinated and delivered up to 17 Kwinana school program clinics and 118 allied health clinics and 8 Rural Health West outreach specialist clinics. So Kwinana Schools program has a positive ENT outcomes due to Wooditch Court's strong partnerships with all the following key stakeholders, including WACS, Rural Health West, ACCHS, Medina, Leader, Aurelia Primary Schools, Gilmore College, Kwinana Medical Centre, GP, Hearing Australia audiologist, which I just want to give Mushy a shout out because she's amazing. She's built such a rapport with the children in the community, and she's absolutely fabulous and makes them feel very comfortable when being assessed. Also like to acknowledge the ENT specialist, Dr. Anton Hinton-Bayer, who's an absolute pleasure to have on board. And his flexibility to attend when we can fit him in because he's so busy. Coburn Aboriginal Ear Health Program and ENT specialists. I'd like to acknowledge all the specialists there who do an amazing job for surgeries. Telethon Kids Institute, West Farmers Centre of Vaccine and Infectious Diseases, Telethon Speech and Hearing, Coburn Integrated Health facility. Thank you, Chloe. You do an amazing job to support our team. And June, thank you, and all the team at Integrated. I did want to just give you guys a little bit of a plug. Thank you so much. And Derbyl Irrigan Health Service, which is amazing with our fast track referrals for the paediatricians. So thank you, Derbyl. And we actually support a lot of our clients coming through the Kwinana Schools program to access Derbyl. So we do actually provide transport, and sometimes we transport depending on our capacity on our services and our drivers. We may offer alternative arrangements for transport, whether it be like say St John's patient transport, fuel vouchers, cab vouchers, and Indigenous outreach drivers. So whatever suits the client the most and gives them as much flexibility as possible. South Coastal Women's Health Service with Babinga Maya. Babinga Maya has a Mums and Bubs program, which we often refer to, and they have an Aboriginal doctor who's amazing there, Dr. Tilly. So she's great with Mums and Bubs, so just Keita would be my advocate there. She's amazing. And the Child and Adolescent Health Services, South Metro, Rockingham Hospital, Perth Children's Hospital, St John of God's Hospitals, Nagala, Callista Parenting Centre, which we utilise for speech therapy at the moment. And over the past years, Coolinga's Playgroup in Kwinana, Keys, Child and Adolescent Mental Health Services, which play a vital role for some of our school children that are coming through with developmental delays as well, and mental health. NDIS and Respiratory Care WA, formerly which was Asthma WA, Anglicare and A+ Nutrition. So we have quite a lot of partnerships for the school program. There are more, but that was, I ran out of room. So a little bit of history around the school program. So The Kwinana Schools program was established in collaboration with community consultation and delivered at Medina Primary School, partnering with community health nurses and local GPs in 2012. So we provide local Aboriginal and Torres Strait Islander students with access to School 715 Aboriginal Torres Strait Islander health checks. The Aboriginal health practitioners perform annual ear health screenings to identify and reduce the number of ear health conditions such as otitis media, which could impact a child's hearing, speech, language and developmental delays. So some of the strategies that we have for our programs, for the Kwinana Schools program is having clinics, the ENT clinics within Parmelia, and also Coburn Aboriginal Ear Health program. We have the 715 Aboriginal and Torres Strait Islander health checks ranging from 4 years, so kindy, through to the end of school, and including health promotion and education. And part of the health promotion and education, we utilise the Simon Says resources from ACCHS. We have fast referral pathways and strong partnerships, collaborations with community, multidisciplinary teams, and integrated health specialist services for this successful ear health outcomes. We provide access to culturally safe services to ensure clients receive holistic care and transport, advocacy, access to culturally safe ear health programs which align with community needs. The Kwinana School program increased service delivery from 1 to 4 Kwinana schools. This has been due to community needs and demand. Several additional schools in the Kwinana and Rockingham catchment would like to implement the program due to high numbers of Aboriginal students needing access to services at their schools. However, the school program team would require additional funding to increase the workforce, resources and program delivery. So I'll just hand you over to Nikita and she'll have a little chat to you about the Kwinana Schools program.
So within the school program, we do see for the schools, which is Aurelia Medina, Leader Primary School and Gilmore College. With Gilmore College, we like to, I guess, combine those health checks alongside the Clontarf Academy and also the Deadly Sister Girls, the STAR program. With Mooditch Court, we like to use our health practitioners to conduct the 715 Aboriginal and Torres Strait Islander health checks. We work alongside Kwinana Medical Centre and we utilise one of the GPs on site there, Dr. Williams. And we also like to utilise the school's AIEOs, so to deliver that culturally safe, appropriate service. Kwinana School program provides wellness packs, education resources, advocacy in health, and obviously complementary services, travel support, and for the appointments. I guess the joys of conducting these checks, you never know what you find. So I guess I experienced obviously otitis media, perforations, grommets. I feel as if when I see my first grommet, I was really excited. Just the colours and obviously the sizes that they range in. Excessive wax. I love wax. I don't know why. Hearing issues, and I'm one of the people who have hearing issues, so I've put my hand up for that as well. And obviously foreign bodies identified, so paper, silly string, and insects. So it's pretty cool. And obviously I still like to thank Lorraine for always helping us with resources, as Simon says. And it's just, I guess, able to sit down there and having a yarn with the kids while they're waiting patiently for their health checks. It's really good to sit down and have that yarn with them as well. And then with the school program, our delivery of programs, we like to obviously fast track pathways linked in with specialists, including here in Australia. Again, we thank Mushi again, she's amazing. She visits our clinic on site in Parmelia fortnightly, and she also supports our Rural Health West outreach specialist, Dr. Anton Hinton-Bayer. He is amazing. Referring surgeries and further ENT consults to Coburn Aboriginal Health Team. So I'll get Monish to speak a little bit about that. The Kwinana School program provides improved school and health outcomes for students to access culturally appropriate services. And we also, one of the best things that we could have our guidelines for otitis media. So yeah, that's always on hand with us. Oh, and lastly, as mentioned, we do have Dr. Anton Hinton-Bayer on site. Kwinana School program ensures continuity of ear health services, seamless access to specialists and for clients and community. Dr. Anton Hinton-Bayer, ENT specialist, and MK team offer support and fast-track referral pathways for surgery performed at Rockingham General Hospital in collaboration with Coburn ENT Clinic. Wooditch Court AHPs work alongside Client and Hearing Australia audiologists, provide support advocacy for school program students. Majority of the audiology and ENT referrals are a result of students completing their 715 Aboriginal and Torres Strait Islander health checks. Oh, and lastly, I'll speak about our visiting allied health services. Sorry, we've got a number of services and people visiting our site. So Allied Health, they visit on site in Parmelia every fortnight. As you can see, we have a dietitian, audiologist, diabetes ed, asthma ed, and podiatry. So our clinics do get pretty full on, but it's the joys of working with Aboriginal health practitioners and with the medical service. So we come across a lot of wide range of people coming on site. So, yeah.
Just want to mention Raj.
Oh, yes. And Dr. Raj, yeah. And also we do have specialists as well visiting. Dr. Raj Malvathu, he's a nephrologist, and Dr. Ken Tong, so he's the endocrinologist. So they visit every 3 months on site.
Funded by Rural Health West.
Yes, and they're funded by Rural Health West. Thank you.
Okay. Do you want me to do this one?
Yeah.
I can just, yeah. So our achievements for the last financial year, I guess. So we screened 244 students at the school with the 715 health checks. We performed 17 clinics across the schools. We delivered 15 health promotions within the school. And we utilise services such as ACCHS for, sexual health. We also use Asthma WA and a variety of stakeholders to come in and deliver education. So we had Wooditch Court delivered last year the 4 Rural Health West ENT clinics for half days. We saw 14 new clients, 26 attended, 11 surgeries, and we had 25 audiology clinics, and we coordinated 125 outgoing referrals to allied health services, including audiology, speech therapy, dental, immunisations, paediatricians, optometry, dietitian, diabetes educator, mental health, and Coburn ENT Clinic. So, Monish.
Okay. So we have mentioned, as you know, so Coburn Integrated Health, the partnership there. So my role is I help coordinate that clinic. So the partnership between Wooditch Court and Coburn Integrated Health, it helps, get the referrals seen quicker, and also we also refer to each other's clinics as well. So sometimes, if ours are full, I can refer to her, and same goes. Wooditch Court staff empower and educate community members on ear health promotion. So thanks to ACCHS and the Ears Health team for supporting Wooditch Court with fantastic Simon Says resources, as mentioned a lot, and the inflatable ear, as you can see here, from promotional events. The feedback from that, everybody loved that. The kids loved it. It was very educational. ACCHS offer training and support Wooditch Court Aboriginal health practitioners, the AHP Ear Health Refresher Training, and also New South Wales TAFE, the Ear Train Practical Workshops. And also ACCHS is supporting and advocating sonic innovation ear health equipment for Wooditch Court.
Stuck.
Yeah, it's just stuck, of course. Okay, and now we're on. We've got 2 stories today, so I'll share the first one. So 9-year-old Jaden began his journey in Kwinana School program on completing his 715 Aboriginal and Torres Strait Islander child health check. It was identified that Jaden required an urgent follow-up with the GP and audiologist. Jaden was fast-tracked to Wooditch Court Hearing Australia audiology specialist clinic for an initial appointment, where he was supported by the Kwinana School program AHP. The audiologist promptly referred him to the next available Rural Health West visiting ENT clinic at Medina with Dr. Anton Hinton-Bayer for quick intervention. Jaden and his guardian later attended the Rural Health West ENT clinic. The Kwinana School program AHP was presented to provide advocacy during the consultation. Jaden was diagnosed with bilateral dry perforations and required a laryngoplasty surgery. Dr. Anton completed the Rockingham General Hospital surgery inpatient form and referred to Dr. Frances Ladigan at Coburn Aboriginal Ear Health Program to perform Jaden's surgery. Jaden received support from the Kwinana School program with transport to access his follow-up ENT appointments at Coburn and the Rockingham General Hospital. Post-surgery, Jaden made a speedy recovery and remained on the Kwinana School program and attends follow-up appointments if required. And we've got another one here as well. So, 3-year-old client was referred by her GP to MKAC and Rural Health West Outreach ENT Specialist Clinic in 2020. As client had relocated from Port Hedland, client previously attended Dr. Anton Ear Bus Clinic in Port Hedland and began to, I can never say that well, to build a rapport with the specialist. Dr. Anton Bayer, Rural Health West Outreach ENT Specialist, reviewed client at Wooditch Court Medina alongside the AHP, Hearing Australia audiologist. Investigation showed a perforated eardrum and a bilateral type B timp results with moderate conjunctive loss in both ears. The ENT recommended bone conduction device, hearing band, or grommets to be discussed further with career. Dr. Anton discussed options with the carer and then completed a Rockingham General Surgery inpatient form and promptly referred on to Dr. Frances Lanigan at the Coburn Ear Health Program to arrange surgery. The client and carer received support from Wooditch Court with transport to access follow-up appointments at Coburn and Rockingham General Hospital, where she later received bilateral laryngoplasty surgery and grommets. The client and carer continued to follow up both at Coburn Aboriginal ENT Clinic and Dr. Anton Hinton-Bayer at Medina Clinics, as needed and supported by MKA staff to ensure seamless care between specialist services.
That's it. Thank you.